Okay, guys, welcome. Let's talk about the Foramina, right, of the skull base. So we're concentrating on the Foramina found within the skull base. So what is important is to know which cranial fossa. So we have a revision on the cranial fossa. Which cranial fossa do we find this foramina? And on which bone do we find this foramina? And which structures pass through this foramina? All right, and the clinicals associated, if there are any. So let's talk about the anterior cranial fossa. The margins of the anterior cranial fossa are these. Anteriorly, we have the frontal bone, right? We have the frontal bone. And posteriorly, we have the lesser wing of the sphenoid bone. And here we have the body of the sphenoid bone, that part you having the lesser wing. And the bones within the anterior cranial fossa, we see the ethmoid bone, the cribriform plate of the ethmoid bone, and the crista galli, right? And here we see the orbital plate of the frontal bone. This is the orbital plate. Why? Because underneath this, you have the orbital cavity. That is the anterior cranial fossa. And if you look at this fossa, we see that all the openings are here. That's why we have all the openings. And on those openings, you have these cribriforms, these foraminas, right? For the passage of the olfactory nerves or the olfactory filaments. This is the crista galli for the attachment of the falx cerebri, the division of the two hemispheres. That is the foramen cecum unpaired for the transmission of the emissary veins. These emissary veins are the veins that will be connecting the nasal veins, are we together? And the sinuses, the cranial sinuses, right? And also we have got openings for the passage of the anterior ethmoidal nerves and arteries. So three things we have talked about. Through the foramen cecum, we have the passage of the emissary veins. Through the cribriform foramina, we have the passage of the olfactory filaments, anterior ethmoidal nerve, and vessels. Middle cranial fossa is between the lesser wing, right, and this part of the parietal bone, the margins of the parietal bone. And this raised ridge on the petrous part of the temporal bone, the posterior ridge of the petrous part of the temporal bone. That creates the middle cranial fossa. Clinically, the middle cranial fossa is so important. Why? Because this is the weakest. This is the weakest fossa. This is the weakest fossa. Why? Because it has many perforations and openings compared to the other fossas. So this one is easily fractured, the middle cranial fossa. That's very important. And which foramina do we find in here? Starting from anteriorly going posteriorly, we'll see a cleft between the lesser wing and the greater wing. This is the superior orbital fissure. This opening is basically connecting the middle cranial fossa to the orbital region. Superior orbital fissure. That means there is an inferior orbital fissure that we will talk about when we will do the orbital cavity. At this point, you have a canal, the optic canal for the passage of the optic nerve. The optic canal. This is also connecting the middle cranial fossa as well as the orbital region. We'll talk about it as well when we do the orbital cavity. This foramen over here is the foramen rotundum. So you see it's posterior to the superior orbital fissure. This is the foramen rotundum. Posterior to the foramen rotundum, going laterally, is another foramen, the foramen ovale. Posterior lateral as well is the foramen spinosum. So foramen spinosum, foramen ovale, foramen rotundum. And all of these foramens are found on the greater wing of the sphenoid bone. They are found on the greater wing of the sphenoid bone. This one is between the greater wing of the sphenoid bone and the lesser wing. This one is between the lesser wing of the sphenoid bone and the body of the sphenoid. Some texts to actually say that the optic canal is found within the lesser wing of the sphenoid bone. Right? This foramina over here, this is the foramen lacerum. Right? That is the foramen lacerum. Are we together? That is the foramen lacerum. The foramen lacerum, what you have to understand about it is that it's not within one bone. Can you see? It's formed basically by 3 bones. The sphenoid, the basilar part giving a small part, the basilar part of the occipital bone. Some may exclude it. And this edge, right, the angle of the petrous part of the temporal bone, right, the medial angle of the petrous part of the temporal bone. That is the foramen lacerum. And then coming there, right, we'll be having a foramen leading to the foramen lacerum. Underneath, if we are to rotate the skull and look underneath, there is a foramen over here that we call the carotid canal. So what is within each foramen? Within the foramen lacerum, we see the internal carotid artery, right? We see the greater petrosal nerve. But for now, these you understand more as we move on with head and neck, right? But for now, just know that we have a foramen lacerum between 3 bones. Here we have the foramen ovale that transmits mainly the mandibular nerve, the lesser petrosal nerve, the accessory meningeal artery. We have the foramen rotundum that transmits the maxillary nerve. We have the foramen spinosum that transmits the middle meningeal vessels and the meningeal branch of the mandibular nerve. So for the foramen spinosum, that's that one. So we see the groove for the mid-meningeal vessels, these ones. So the mid-meningeal vessel will be giving branches, right? It will be giving branches, and the anterior branch is the one that will pass through the pterion. That's why we say that part is the weakest part of the calvarium. Hence, a blow from outside can cause intracranial bleeding. I won't talk about this. This is for the posterior cranial fossa. So let me actually remove it like that. Right. Internal costal meatus. So now we have the superior orbital fissure that we say it transmits what? The ophthalmic nerve. For now, just know it transmits the ophthalmic nerve, right? We'll go on to the divisions of the ophthalmic nerve when we do the orbit. But it transmits the ophthalmic nerve, ophthalmic vein, oculomotor nerve, cranial nerve number 3, cranial nerve number 4, cranial nerve number 6, sympathetic fibers, and also transmit the branches of the middle meningeal artery and the lacrimal artery. So branches of the middle meningeal artery and the lacrimal artery also pass through there. And probably they'll be moving with the sympathetic fibers, because in the region of the head and neck, the sympathetic fibers will be moving with the arteries. The carotid canal, this is the one that ends by entering the foramen lacerum. So what does it transmit? It transmits the internal carotid artery. So the lower part of the internal carotid artery is within the carotid canal, and then the upper part will exit and enter the posterior part of the foramen lacerum. So if you look at this, it will have entered the carotid canal there and then exit out by entering the upper part of the foramen lacerum. And here we are. The optic canal transmits the optic nerve, cranial nerve number 2, and its coverings, the dural sheath, and the ophthalmic artery. So the ophthalmic artery is in the optic canal. The ophthalmic vein is in the superior orbital fissure. Cranial nerve number 2, optic canal. Cranial nerve number 3, 4, and 6 are within the superior orbital what? superior orbital fissure. Let's talk about the posterior cranial fossa. Posterior cranial fossa is formed by this ridged part, right, of the petrous part of the temporal bone, right, and the occipital lines. That forms the posterior cranial fossa. And one thing about this fossa is that it's not as weak as the middle cranial fossa, right, but it's more depressed than the other fossas, right? That means the most raised fossa, this one, followed by this one, followed then by this one. This is where the cerebellum will be sitting, right? This is where the cerebellum will be sitting. And then the openings here, we have this large opening, the foramen magnum, right? The foramen magnum for the transmission of what? Obviously, brain tissue, right? This point is where you have the medulla oblongata, right? And some may say that is where you have the junction between the medulla oblongata, right, and the spinal cord. This foramina over here, this is the condyle, the hypoglossal canal. It's found on the condylar part of the occipital bone. So the hypoglossal canal found on the condylar part of the occipital bone. And because this part is so hard, right, that means this part is not easily fractured. Hence, whatever passes through there is less prone to damage. Then we go on to this foramen, like the foramen lacerum. This foramen is guarded by two bones, right? This is the jugular foramen. That is the jugular foramen, right? Bounded but between two bones. We have this foramen here, right? And underneath this part, we have the internal ear, right? So this is the internal acoustic meatus. Internal acoustic what? Meatus. So let's see, through the foramen magnum, we have the medulla oblongata, right? Some may say the junction between the medulla and the spinal cord, and you have the coverings, the meninges, you have the vertebral artery and vein, anterior and posterior spinal arteries, you have the roots of the accessory nerve, cranial nerve number 11, sympathetic plexus on the vertebral artery, the apical ligaments of the dens, and the tectorial membrane. Those are the main things. We have the hypoglossal canal that we said it's on the condylar part, and this canal, right, protects this nerve because this canal is on this hard part, occipital bone, the condylar part. So there is passage of the hypoglossal nerve and the meningeal branch of the ascending pharyngeal artery. The meningeal branch of the ascending pharyngeal artery. Then we have the jugular foramen that we said is bordered by two bones, occipital bone and the temporal bone. These transmit the glossopharyngeal nerve, vagus nerve, accessory nerve, inferior petrosal sinus, the sigmoid sinuses, and the internal jugular vein. So it transmits cranial nerve number 9, 10, 11, and the inferior petrosal sinus and the sigmoid sinus, as well as the internal jugular vein. Let me explain this part. You have the internal jugular vein, sorry, the jugular foramen at this part. So you have the jugular foramen at that part. And I want to explain this whole principle about these sinuses. We'll do them later on in terms of venous drainage of the cranium. But you have a sigmoid sinus. So you could be having a sigmoid shape. The sigmoid sinus. And the sigmoid sinus will, within this foramen, continue, right, as the internal jugular vein. So the sigmoid sinus will continue as the internal jugular vein going down, right? So both of these are within the jugular foramen. That's why we see the sigmoid sinus there, the internal jugular vein over there. What about the inferior petrosal sinus? So there's a sinus that we call the inferior petrosal sinus that enters here and decides to drain into the internal jugular vein. So it's also within this foramen, right? Apart from these blood vessels, we then see cranial nerve number 9, 10, and 11. And then another opening that we crossed here, internal acoustic meatus, it's actually within the posterior cranial fossa. The internal acoustic meatus is at this point. So what does it transmit? It has to transmit a cranial nerve that is concerned with hearing, right, and balance. That is the vestibulocochlear nerve, the vestibulocochlear nerve. That is cranial nerve number 8. Cranial nerve number 8. Are we together? And then on top of that, it transmits an artery that is called the labyrinthine artery. The labyrinthine artery. So it transmits labyrinthine artery, the artery to the internal ear. That one. All right. So that is that. And also on top of that is transmission of another cranial nerve for the face. That is cranial nerve number 7, the facial nerve. So this transmission of the facial nerve, cranial nerve number 7. So what do we have? Cranial nerve number 7 and 8, 9, 10, 11, cranial nerve number 12. So 7 and 8, 9, 10, 11, 12. Are we together? Yes. Now, that is that. So anyway, that's the information you have to know in terms of the foraminas of the cranium, right? And the facial nerve will be moving with its sensory companion that we call the nervus intermedius. The nervus intermedius. It's part of the facial nerve, actually. The nervus intermedius as well passes through that. Internal acoustic meatus. So we have the vestibulocochlear nerve, labyrinthine artery, facial nerve, and nervus intermedius. Are we together? And within this foramina, right, just a little information there. Within this foramina, we find that cranial nerve number 7 will be on top of cranial nerve number 8. So cranial nerve number 7 will be on top of cranial nerve number 8 within that canal. Anyway, so there is a little picture just showing some numbers in the foramina over there, right? Now let's look at the clinicals associated with this. So there is fracture of the anterior cranial fossa, right? That leads to blood leaking into the nose, right? So bleeding within the nose, that's what we call epistaxis, right? Why? Because the nasal cavity is underneath the anterior cranial fossa. On the roof of the nasal cavity, we have the ethmoid bone, right? That is also the base of the anterior cranial fossa. We can have cerebrospinal fluid also leaking through the nasal cavity. That is called cerebrospinal rhinorrhea. We can also have that all of these fluids and blood leaking into the orbital cavity that causes outward bulging of the eye. That is what we call exophthalmos. Fracture of the middle cranial fossa, that's to say that is the most common one, can also lead to cerebrospinal rhinorrhea, but the fluids will be moving using the body of the sphenoid bone. So there will be a fracture of the body of the sphenoid bone and the fluid will move within the sphenoidal sinuses. And once they get there, they can easily move into the nasal cavity. Why? Because the sphenoidal sinus communicate with the nasal cavity. Posterior cranial fossa, fracture of it can lead to blood accumulating within the posterior triangle of the neck. Posterior triangle of the neck, right? And we say within the posterior cranial fossa, the least prone to damage nerve is the hypoglossal nerve. Why? Because the hypoglossal canal is on the condylar part, which is the strong part. Are we together? This blood can also leak into the nasopharynx. It can also leak into the nasopharynx. Okay, guys, that was it on the foraminas of the cranial base. Anyway, good day.